And the stiffness can be anywhere in the body. Not everybody's the same, so it could be the back, it could be the wrists, it could be the hands, it could be the knees, things like that. And oftentimes I get people say, I keep getting tennis elbow. I was one of them.
Yeah.
Once I got rid of the inflammation, it wasn't happening. Because tennis elbow theoretically is from gripping like a tennis racket. Plantar fasciitis, that's like heel pain when they step out of bed. People will say, oh, it's because it's inflammation, especially when things keep happening over and over, or they just don't get better because there's something going on, and until you figure out what that is, you're going to just be treating the symptom.
Got it.
Okay, so inflammation is a big one, and I have a 100% record of getting rid of it.
Okay.
100%. Okay, so you should be reassured about that. Okay, one of the ways to get rid of inflammation is to make sure you have enough omega-3. There are so many studies, sometimes it's equivocal. They'll say, well, it does help, and other times it doesn't help. I'll give you what the straight answer is. It works when you combine it with the complete package, the way I do it. It works 100% of the time. But your omega-3 level was measured, and it's on the lowish side.
Okay.
And omega-3 has an anti-inflammatory property, whether it's the joints, or whether it's inflammation, whether it's the heart. That's why there's this mixed studies that say it's good for you one day and the next day it doesn't show benefit, but it will show benefit when you combine it with a synergistic combination, which I'm going to demonstrate by the end of the conversation today. Your omega-3 level, we call it omega check. It should be well over 5.5, yours is 3.2. We further broke it down to EPA, which benefits the cardiovascular system. It should be over 2, yours is only 0.3. We've got a lot of work to do, but you know what to do. So now we're going to remember that target I said. I'm going to give you a target, and I'm going to give you a roadmap, and I'm going to help you get there. Now you know one of those targets. The DHA is also a component of omega-3, which helps the brain more, should we say. And it should be over 4. Yours is 2.1, so halfway there. But as I said, the cardiovascular benefit is always number one, because I have a phrase, and that phrase is, what's the number one killer for a man? Heart attack. And then I say, what's the number one killer for a woman? Heart attack. Then I usually do a trick question. What's the number one killer for a cancer patient? They're going to say cancer, but it's heart attack. So you'll find me going back to the heart, even though on the other hand I told you you're premenopausal, your blood pressure's great, your cholesterol's great, you're not at risk now. But post-menopause, you don't have the benefits of the hormones, so your risks will be the same as a man. That's why the number one killer for a man is a heart attack. The number one killer for a woman is a heart attack after menopause, generally for most cases. Okay. So so far so good?
Yes.
Inflammation, even though the cardiovascular system looks very sound.
Okay.
But we're going to fast forward. What happens when you are postmenopausal? When the cholesterol numbers are not that great? When the hormones don't protect your cardiovascular system, then that inflammation will definitely put a risk on the cardiovascular system. Okay. And in the meantime, any inflammation around the body is just bad news. So let me give you a little background about inflammation. Because if I tell you about its significance, then everything that comes afterwards about where it's coming from and what to do, you'll be more motivated to say, you know what, I've got to get rid of this. So the studies are very clear. We don't have a lot of markers for inflammation. This is one of the best ones that we have. But the studies are very clear. Almost every disease is preceded by inflammation. So I'll give you the obvious ones first. Arthritis. Arth stands for joints. Itis stands for inflammation. Arthritis is like joint pain or osteoarthritis. I'm just stick with the simple one. Rheumatoid arthritis. You can have colitis. C-O-L, colite, that's colon.
Right.
Itis, inflammation of the colon. How many TV ads do you see with Crohn's disease and ulcerative colitis? They're young people, by the way, and it's increasing by day. How about dementia? You're going to say, well, that's just maybe blood vessels. It's inflammation. Because the inflammation is followed by repair tissue. That repair tissue is a special protein and is deposited in the brain. And if the protein is depositing and replacing the brain cells, guess what happens? The brain function, the memory goes down. So almost every disease that we know of, almost every disease, is preceded by inflammation. So even like arthritis, which people will tell you is just old age and wear and tear, that's probably true. Genetics, wear and tear. But if you have a background of inflammation, you'll wear and tear faster. Does that make sense?
Yes.
So when you say you're stiff, you're actually inflamed, and you'll wear and tear faster. Does that sound good?
Yes.
It's not good.
Exactly. That's not
right.
good, but yes, I understand.
Yeah. So my job is to 100% get rid of your inflammation. We got a deal?
Deal.
Right. Let's ask ourselves where it's coming from.
Right.
We know that it comes from the liver, and then the liver is connected to the gut. So I want to focus in on your food sensitivities and identify what we found. Let's explain the technique of this blood test. It's a blood test. So we didn't measure food, we measured antibodies in your bloodstream. The kind of antibodies which might not be beneficial. Okay? Because this special test has two types of tests, antibodies and something called complement. When your body is invaded by bacteria or parasites, having antibodies and complement go out to attack is a good thing. But not if you are attacking your own food that you just ate. So what we were able to do is test for 132 different items of food, coloring, chemicals, additives, preservatives, the kind of thing that you might ingest. And so if we find antibodies and complement attacking it, you need to know about that. Because what that will do is it'll allow the breach in the gut, which then will allow the liver to produce the inflammation.
Got it.
See, the gut, the liver, inflammation. The gut, the liver, immune system. It's the core of all health. Just to make it complete, the liver is connected through lymphatic system.
Yes.
Those are like ducts that branch all over the body. Well, those branches have to go through the liver. They have to go through the spleen. They then get connected to the bone marrow, where those special white blood cells come from. Those are the white cells that fight cancer, bacteria, parasites, inflammation. So that's why the liver is such an important area to focus in on.